go.
Hi, my name is Dr. Isabel Northington. I'm a physical therapist, and I wanted to show you some techniques today of how to relieve some tightness in your piriformis muscle, which is the muscle deep in your glute and also in your low back. So one of the things you can actually use that's a very helpful mobilization tool is a rumble roller. You can actually pick these up at your local stores like Academy, Dick's, and even online at Amazon. The different grades are reflected by color. So the black one is actually the most aggressive one. Today I'm using a blue one, which is a little less aggressive and a little less hard than the black one. So say I'm having tightness throughout my glute muscle. The piriformis is very deep into the glute, and this is a great tool to mobilize that. So today I'm going to show you a technique of how to mobilize the right piriformis. Usually runners get this pain when you are running for a long time, especially long distance runners. Your abdominals tend to give out, and then you recruit movement muscles for stability. And those muscles can get tight and painful. So here is the way to properly roll out your piriformis muscle. So first thing is you kind of just sit and get comfortable on the foam roller. You actually are going to bring the affected leg, usually both legs are affected, but you focus on the one that you're doing, and you actually just shift the leg over. Now some people don't have this amount of flexibility, so you kind of have to go a little bit lower, and maybe your leg a little bit lower here, and that's okay. But for me, I'm really going to try to get an aggressive mobilization on myself. You're actually going to bring that affected side up. You're going to rotate towards the affected side, and you're actually going to put pressure on your affected side's arm for stability. And then you're actually going to just slowly mobilize. So you're rolling out really slow. And when you find that area of tension, if you can tolerate it, go ahead and just sit there for a moment until you feel that release. So you might feel a little bit of uncomfortable stress or tension, but as you sit on it and stabilize on it for a little bit longer, you'll notice that the tension releases. And so you just kind of give it a little bit more of a push, maybe add a little bit more body weight, and kind of just hold and stabilize there, so you're actually getting fascial mobilization. And usually for me, I try to do it about 20 times, if not more, until I feel like I've got some elongation in my soft tissue. I'm just going to do it a little bit here. And like right there, I found a point of tension, so I'm kind of just going to hold it for a little bit. It actually feels pretty good after a while. So now I'm going to show you a mobilization for your low back and T-spine. So
Okay.